Prostate cancer is the second leading cause of cancer death in American men, according to the American Cancer Society. And a recent controversial decision about prostate screenings has some people worried about men's health. So to get a better understanding of the screening process and whether or not it's necessary, I talked to urologist Dr. Joe Carbone.
Well, actually, Emily, they're not even telling you to get PSA screening at all. The United States Preventative Services Task Force has come out with this recommendation that PSA screening in men age 50 is not necessary. Wow. And it really concerns me because of all the progress we've made through the use of PSA over the years. The mortality rate from prostate cancer has dropped by 40% since 1990, and that's when basically we're starting to use the PSA as a screen for prostate cancer. Now, I'll agree with him on several points. PSA is not a good marker for prostate cancer. It's not prostate cancer-specific antigen. It's prostate-specific antigen. It means that something's going on in the prostate, one of which may be cancer. And so it really needs to be discriminately used. We have done things like try to figure out velocities or densities, and we've tried to find derivatives that are more specific for prostate cancer. But to just stick your head in the sand and say, oh, I'm not going to worry about it, makes me fear that we're going to go back to the 1960s when a lot of these deaths from old age and natural causes were prostate cancer that had never been diagnosed.
Now, if they're suggesting not getting a screening at all, how do, if somebody's 50 or 60, how would you be able to detect it?
Well, that's the problem. It's a very, very common diagnosis. It's something like 1 in 7 or 8 men develop the problems with prostate cancer, and it's a silent diagnosis. See, when patients come into me and have urinary problems, urgency, frequency, blood in their urine, even if they have an elevated PSA, I'm less concerned about the possibility of prostate cancer because they're symptomatic. It's the individual who has no symptoms whatsoever, has no problems urinating, and yet has an elevated PSA that kind of puts up a flag that this might be prostate cancer.
Now, what folks out there would you say need to get a prostate screening at 40 for sure?
Well, I usually adhere to the National Comprehensive Cancer Network recommendations, and that's where we say men age 40, regardless of family history or whether they're African American, should get a PSA. Now, men who have a family history or are African American should start annual screening at age 40. But if a man has a PSA higher than 1.0 at age 40, that puts him in a high-risk category equal to that of African American males or patients with family history. So that individual may start screening at 40 as well. Otherwise, 50 and above with an annual PSA and rectal exam.
And the exam itself, what exactly do you go into?
The examination, the physical examination, well, unfortunately, it's something we've never been able to get around, and men know very well what a rectal examination involves. But the bottom line is we're trying to feel for any abnormal nodules or bumps or lumps on the prostate, which are an independent predictor for problems with prostate cancer.
And are there any kinds of signs and symptoms that might be pointing to prostate cancer?
No. And that's the real take-home message, is that if you are symptomatic, if you have urinary symptoms, it's less likely prostate cancer is the cause for an elevated PSA than if you're otherwise asymptomatic.
So better safe than sorry, right?
That's really the take-home message. And I really am concerned about this task force recommendation that it will really take hold, and a lot of people will start disusing PSA, and then we'll be back to the point where we have a 40% increase in mortality due to prostate cancer.
And if you'd like to learn more about prostate screenings, you can always give Southside Urology and Nephrology a call. They have 3 locations, Danville, Martinsville, and South Boston, 1-800-446-9117, and SouthsideDocs.com is where you can get more information.